This is part two of our conversation with Dr. Fidel Ballesteros, where we talk about exercise guidelines for diabetes and obesity. If you want to listen to part one, just go to episode 7 of the Fitness Faculty podcast. Now for the show.
At this point, can we move on to obesity and diabetes naman?
Sure, sure.
Yeah, alright, sige. So the next thing naman is diabetes. I think it's the second most common condition that
Mhm.
almost everyone will have a family history of diabetes. Again, wala akong kilalang tao na wala sa family history nila yung diabetes. No, there's always going to be some grandparent, uncle, even their parents na may type 2 diabetes. So, talk to us about first what diabetes is
Yep.
and uh, exercise recommendations and precautions for people with diabetes and who want to start exercising.
Sige. So let's define the problem muna. So diabetes is an endocrine disease. So sakit siya dun sa capacity ng katawan natin to move the blood sugar na from our food after digestion, move the blood sugar to the cells that need it. So yung muscle, the brain, foremost kasi blood sugar lang ang nagpapaandar sa utak natin. People with diabetes, impaired na yung sistema na yon. Now, there's two types of diabetes mellitus. You have your type 1 diabetes. Sir Gary V is actually one of the more famous examples. Ito yung diabetes na nakukuha from childhood pa lang. It's actually an autoimmune disease na yung mga antibodies mo are destroying yung cell sa pancreas. So yung pancreas po, yan yung organ na naglalabas ng insulin ng katawan to tell the blood sugar to go into the working cells. And then you have type 2 diabetes, which is now being more common compared to type 1 diabetes. Dati, ang alam lang natin, sakit ng matanda yan, sakit ng mayaman. Pero ngayon, we're actually seeing cases of diabetes in all walks of life. Si type 2, so hindi naman sira agad yung pancreas niya, pero but what we have here is what we call insulin resistance. Yung katawan, dahil sobrang sanay siya ng high intake of sugar, kasi industrialized diet na tayo ngayon and everything is one click away, no? So we're eating more calories now compared to before. The body cannot process that fast enough, and then eventually, as a whole, it develops resistance to insulin. To picture that lang para mas simple. Si insulin, siyang may akay-akay kay umaandar si blood glucose sa dugo. Si insulin, siya yung kakatok sa pinto ng muscle or ng brain or other organ tissue. Sasabihin, oy, may blood sugar dito, pasok, papasukin nyo. Kasi you need it, di ba? Sabi nung tissue that needs it na, hey, we have too much already. We don't need that anymore. So eventually, the body develops a resistance to its own insulin. Kaya yan yung type 2 diabetes. What usually differs in terms of picture, type 1 diabetics, so bata pa lang, meron ng diabetes, nag-insulin most probably, and mas mapayat sila. So, hindi sila yung picture na diabetes na familiar tayo ngayon.
Yeah.
Whereas the type 2 diabetics, yan yung obese, most of the time kasama ang overweight or obesity. And they have other problems such as sa mga babae, pwedeng mag-develop ng polycystic ovarian syndrome, kasama yung insulin resistance doon. Some people will have hypothyroidism on top of the diabetes. And then yun, yung metabolic syndrome. I think some of our fitness professionals are familiar with that term kasi kasama yun sa mga certification na discussion eh. Impaired insulin resistance, merong insulin resistance, pati yung cholesterol, mataas, obese, hypertensive. So, yan yun, medyo mas malaki yung spectrum of problems when it comes to type 2. Ngayon, yung question ni Sir Wisdom in terms of guidelines, so we can jump naman agad into that. In terms of exercise guidelines, for type 2 diabetes, so magkaiba. For type 2 diabetes, similar to the general public. People have insulin resistance because yung diet nila, which they're used to, and yung lack of physical activity as well. No? So hindi, most of the time, papasok yan dito. Sedentary yan, hindi yan ayaw niya
Mm.
mag-exercise
Yeah.
or
Yeah.
they don't have the experience. Uh, so, dahil similar naman yung magiging recommendation. So, yung most days of the week, 30 minutes minimum up to an hour of low-impact aerobic exercise na moderate intensity that we're all familiar with. The real hurdle here will really be yung behavioral change. Trying to get to the bottom of what will make them want to do exercise. Uh, so yun, counseling will definitely be at the forefront bago pa yan mag-start ng exercise. Uh, in terms of type 1 diabetics though, so medyo wala silang masyadong body image issues, lalo na kung hindi naman sila naging obese. Although some type 1 diabetics can be obese. Exercise recommendations will be specific. In terms
Mm.
of dapat yung fitness professional, alam niya or nabigyan ng advice yung kliyente niya, kailan ba ako magtuturok ng insulin, kailan ako kakain, at kailan lang ako pwedeng mag-exercise na moderate intensity or vigorous in between all of that. The reason being, for type 1 diabetics, dahil nga uh, totally poor na yung insulin production nila, um, and nagtuturok sila ng insulin na exogenous, exercise will provide an insulin-like effect. Yan ang physiologic effect ng exercise in terms of endocrine. It shifts the blood glucose faster to the working muscles. And chronic adaptation din siya. So meaning, just to give an example, type 1 diabetic or type 2 diabetic na naka-insulin, tapos hindi na pag-usapan kung ano yung schedule or what. Nagturok siya ng insulin ngayon, within 30 minutes, nag-start na yung exercise program niya, kumain lang siya ng konting snack,
Bumaba
magda-drop
ang
yan.
blood pressure, ang blood
Hypoglycemic.
sugar.
Oh, yes. And for type 1 diabetics, we as much as possible, we don't want blood sugar to drop. I mentioned earlier na the brain only consumes sugar as a source of energy. So, maapektuhan yan. Yung panghihina nila can actually lead to coma or
Mm.
ketoacidosis for most. So yun, very careful tayo doon. In terms of when to exercise, generally, dapat nakakain na muna sila. Yung insulin nila was about more than 30 minutes ago para yung peak effect niya hindi sasabay dun sa time ng exercise. Ideally, siguro mga
Sorry,
1
this
to
is
2 hours
for
after.
type 1 or type
Type
2?
1.
Or pareho? Type 1, okay.
Sige, to make it clear, type 1 or type 2 na naka-insulin. Basta yung insulin
Mm.
injection yun ng common natin dyan.
Mhm.
Dapat yung spacing is, nauna na yung insulin and kain way before. So mga 1 to 2 hours siguro before, after the insulin and eat ng kain, and then tsaka mag-exercise
Okay.
before the next insulin injection. However, syempre may mga personal preferences pa yan. So you have to negotiate paano kung yung insulin and diet schedule ng tao, hindi mo pwedeng ilagay sa after dahil may trabaho or busy
Mhm.
or talagang hindi niya lang prefer na ganun. The best choice of action therefore will be just to talk with the patient's or the client's doctor. Doc, ano po bang, I'm the fitness trainer of this your patient and na-advise niyo po mag-exercise o pumunta sa akin. Could you give me a specific time? Ano po ba ang pwedeng i-recommend na time slots na we can conduct our exercise? Yun, that would be the safest for both the patient and the professional. Tapos, lagi lang merong sugar gel, kung mayaman. Or pwedeng zesto lang, pwede na yon, no? Na naka-ready. Siguro yung trainer or the fitness professional, wag lang kabahan pag nakita niya nag-check ng blood sugar yung kliyente niya. No? Dapat that should be a norm kasi during exercise, ideally sa mga rest periods, mag-check din yung client para sure siya na, oh, hindi ako nagda-drop ng blood sugar. Pwede tayong tumuloy. Pwede natin tapusin for the next, for the entire session. Ganun.
Kasi kasi safety din siya, safety component din siya kasi let's say nahilo ka because of your sudden drop in blood sugar while doing exercises. 'Di ba? May risk factor din eh.
Yeah.
Yep.
So, na-mention mo si Gary V. He's been my client for 10 years now.
Ayan, oh,
So,
yan, familiar ka na.
napagdaanan ko talaga yung lahat ng klase na pag-check ng blood sugar. So, nag-start kami, turok pa. Tapos, eventually, nagkaroon na siya ng constant glucose monitoring. Uh,
Naka-CGM na nga siya.
Naka-CGM na siya ngayon eh. So, sa bilis. Pero yeah, tama. They have to check every once in a while. And then, like what you said, I actually did a video series with Gary and na-share niya before, yung nagkaroon siya ng time na nag-coma siya, almost. I mean, talagang bumaba yung blood sugar niya. He was actually preparing for a show. And then he woke up, he was already in the emergency room. Na parang in emergency pen na siya. And
Yeah.
that's that. But again, Gary's type 1. That's different from type 2, I guess, na
Yeah.
kaya mo nga, it's the same. Pero if they're taking insulin, it's the same. Pero basically, yun yung experience ko, and it's important that you are in constant communication with your client and the doctor. I'm fortunate kasi si Gary knows everything there is to know about diabetes.
Kasi bata pa lang eh.
He was diagnosed when he was 17.
Yeah.
Basically, he funds research. Tapos parang he's really into discovering, and he turned 60. I think he turned 60 na. So for somebody who was not given a very long lifespan, that's actually pretty good for him. Pero na-mention mo na, eto, tanong ko lang, kasi si Gary loves to bike. As in, he bikes long distances. Wala namang contraindication ba when it comes to those kinds of extreme exercise regimen or exercise activities? Kasi he might be one in a million, di ba? So we don't want to say na parang, kaya ni Gary V, kaya na lahat yan. Pero basically, parang he goes for 4-5 hour bike rides. But again, to the general public, he does this with 2 or more na sumusunod lang.
Yeah.
Talaga meron siyang convoy, meron siyang car, meron siyang emergency person there, not 1 or 2 at least. So at least kung may mangyari sa kanya, there's always somebody who will be there to rescue him.
Yeah.
So hindi tayo lahat may ganun. Pero are there any contraindications na pagdating sa extreme exercises like that? Somebody with diabetes.
Again, syempre, nasa lang, spectrum lang yan eh. Too little, just enough, too much. However, determining the too much also depends on the individual. Again, Gary V as an example, he's been physically active way before pa mangyari yung mga complications ng diabetes niya, di ba? And sanay na rin siya to manage. May self-management capacity na siya, which is our goal actually for all our patients. We want them to actually be able to adjust their own insulin. Depende sa swings ng blood sugar nila. Pero then again, as you mentioned, hindi naman lahat ng nasa public na may ganyang condition will have that capacity. And most of the time, especially the type 2 diabetics, sedentary. So generally, we would still recommend na mag-start muna sila with the low to moderate intensity, especially for sedentary. Again, going back doon sa pinakita ko kanina, di ba? Sedentary pero hindi pa considering na may disease, and diabetes is actually a cardiovascular risk. Sedentary individual, vigorous exercise, 2 to 10 times the chance of a myocardial infarction or bara sa puso. And then other problems pa, syempre, increased yan. So, go slow first. Pakiramdaman yung sarili. Prioritize managing the disease, definitely. So, if someone really wants to get to that point, definitely, on the frequent follow-ups with their doctors, they should ask din, Dok, kaya ko ba na pwedeng ako yung mag-check tapos adjust ako ng ganito? And the doctors will gladly teach, I'm sure. Endocrinologists, diabetologists will want their patients to be self-efficacious. Sarili nila, kaya nilang mag plus minus 2 lang naman usually yan eh. Para depende dun sa blood sugar nila for the day. With what Gary V is doing, yung mga long distance niya, definitely dapat pati sila may kasama din. Yun na nga, you'll never know at the point yung tagal na yon na mag-ride ka tas malayo, hindi ka taga doon na lugar. I mean, ako naglo-long ride din ako eh. Enjoy bike rides na malayo. And you'll come to places talaga na there's no one around. So pagka nag-hypoglycemia ka doon, manghina ka,
Yeah.
saan ka lalapit, di ba?
Mm.
So, ano yan? Conditional yan. If you have buddies na alam yung condition mo, they know what to do, and they know who to call, at alam nila kung ano ibibigay sa'yo, just make that preparation. And siguro, kung if you're on insulin, tapos hindi ka pa, or first time mo magta-try na long ride, ano lang, gradual, ano lang. Siguro, try mo muna, 1 hour ride, tignan mo anong response ng katawan mo. Check ka ng blood sugar during, check ka ng blood sugar after. Pag nakikita mo na yung pattern on how your body responds with the current medications you are in, at least you'll be more prepared, or you know what to prepare for during that duration of exercise. And matitimpla mo rin kung bibilisan ko ba, dahan-dahan lang ba, kaya ko bang mag-climb sa ganito, kung may ano yan, kung may climb yan, no? Yun, high intensity yun, vigorous intensity yun. Ilang minuto ko lang kayang i-push yung sarili ko at to that point na okay, slow down na, check blood sugar, take a sugar drink or a sugar gel. So mga ganon. So walang blanket statement dito. You really have to educate yourself, consult with the professionals, and make sure may body system, meron kayong lifeline ba. Alam mo rin kung sa lugar na yon meron ER doon in case magka-problema. Hypoglycemia naman most of the time na hindi komplikado are addressed quickly in the ER. Hindi naman sila na-admit kung mababa lang yung blood sugar. May mga complications pa kasi yan na yun na-admit. Pero for a lot of people, pag mababa blood sugar, we usually just give IV glucose, tapos insulin, and then pag okay yung blood sugar nila, wala kaming makitang problem sa puso, sa kidney, we send them home. No? Yan.
So sa diabetes, it's more of, number one, it's being mindful of the timing ng kain, ng insulin.
Yes.
And number two is monitoring your blood sugar, even during exercise, ba?
Yeah. Pwede in between sa mga rest periods, you can check.
And then for the exercise prescription, it's very similar to the general population. No, it's just that on the side, you're also managing your condition.
Yes.
Is there any benefit to the condition from exercising, or is it more of overall health pa rin? Kumbaga, is there any additional benefit to being able to manage your diabetes if you exercise?
Yes, very much. Sa American Diabetes Association, actually, after doing residency, nakita ko yung mga treatment guidelines for lifestyle diseases. The first thing lagi sa management is lifestyle improvement bago pa mag-start ng medications. So, for diabetics who are already on medication, exercise, the right kind and the right amount of exercise will regress or make it better na makontrol yung blood sugar mo. Kasi nga, as I mentioned kanina, exercise has an insulin-like effect. Diabetes, impaired na yung ganong function eh. So, exercise can help reduce yung HbA1c, if you're familiar, yan yung mga minomonitor sa mga diabetics. Also, definitely for type 2 diabetics, sama-sama yan eh. Pag type 2 DM, overweight, obese, blood lipids are also mataas. They would have probably other endocrine problems. And mas mataas yung cardiovascular risk dahil diabetic, mataas ang lipids, obese. No? Tapos with age pa. So, the diabetes and the cardiovascular prevention benefits will be there. Provided na, syempre, yun na nga, the problem with them is they don't want to go into exercise na regular. So, dapat the doctor and the fitness professional are also providing motivational interviewing and counseling for the patient para mas maging frequent. Again, going back dun sa guidelines, we don't want to hit those numbers naman agad. Ang importante, actually, pinaka-importante, frequency. If we can convince our patients and clients to be as much as possible, almost every day na merong exercise, kahit 10 minutes lang yan, 20 minutes, that's the first goal. And then eventually, we work on the intensity, we work on the time, we work on the type of exercise, kung anong gusto nila. And then yun na yun.
Okay. So you also mentioned earlier, they usually come in pairs, no? Parang obesity and diabetes.
Mhm.
And hypertension.
And nga,
Kasama.
hypertension ba kasama?
No?
Na para siya unholy triad sa tuhod, no?
Barkada,
Kaya, no?
barkada yan.
Oo nga.
Barkada
Pero,
nga.
pero when we talk about obesity, specifically, nowadays, because kasi you just have to look at schools,
Mhm.
dami ng mga bata na are overweight or obese.
That's true.
And it's not just something that happens later in life. So maybe we can talk about that obesity in specific, as well as yung effect ng obesity in kids, and are there of course we want our kids to exercise, but how would that go, parang getting an obese child into an exercise or physical activity plan?
Okay, so specific tayo about kids muna, no? That's true. Actually, in terms of obesity and diabetes, and I think your dad will know, si Sir Herc. Kasi member siya, or naging past president ata siya ng PASO.
Yeah, he's one of
Tama, no?
at least now he's a board member, yes.
Yeah, yeah. There's what we call a diabesity pandemic. Dati kasi hindi ganun karami ang type 2 diabetics. But now we're seeing both entities in one person, and we're diagnosing obesity and diabetes among teenagers as early as teenagers pa lang. And it's not type 1, type 2 siya, no? Because of, industrialized diet, all the access, yung one push of a button lang, you get what you like. High sugar drinks, high sugar food. With kids, definitely, the ano naman, the common guideline there is playing, no? So we're talking about kids, hindi pa adolescent, no? Pag nakita na natin yung bata na mukhang overweight or obese, so may separate yan, hindi natin ginagamit yung BMI for adults, the pediatricians, and actually, meron namang may guidelines naman na susundin dyan para ma-measure mo kung overweight or obese, but not the adult one. If they are screened to be overweight or obese, we encourage them in terms of physical activity na play. So, as minimum of 10 minutes per day, 4 days in a week, and then moderate intensity muna if they're sedentary. Siyempre, ang magiging challenge dyan, yung bata, pwedeng nagde-develop na rin ng body image issues. This goes for the adults as well. So, it might be difficult to motivate them to play with the other kids. Ang magiging scenario kasi niyan is, sa school lang siya i-encourage mag-play. Pero pag uwi sa bahay, the parents, syempre, ayaw mo na makulit, ayaw mo, you want peace at home. Pero the thing is, yun na nga din yung setting eh. They're not used to being active because at home, they might be restricted then. So we have to talk to the parents as well, encourage siguro an area na they can engage in play, yung TV, cut down yan. For children na pre-adolescents up to adolescent, minimum of 2 hours lang of screen time for a day. For toddlers, dapat 1.5 or less. No? So dun pa lang, medyo one step na yon. And then, gagawa ka talaga ng avenues of play. Kung masikip ang bahay, if you're, a lot of people in Metro Manila, condo ang buhay, no? Maximize nyo yung facilities ng condo nyo. If you have a roof deck, samahan nyo. Make sure lang, safety, syempre. Or kung may playground sa baba, gamitin. No? Encourage the kid to play. Definitely, kung hindi, kunyari, tara, laro tayo. Maglaro ka din as a parent, di ba? Again, kids will follow what their parents do eh. Trial and error. Tapos you really just have to you have to find saan ba may interest yung bata. Experiment lang ba? The goal here really is just to, as much as possible, every day, meron silang minimum of 10 minutes na tuloy-tuloy silang active. And then that's a start. Some kids will probably want to go to sports. Merong team sports, merong individual, no? For the
Yeah.
kids,
For the kids, yeah. So
Alright.
for obesity, which is a BMI of 30 and up,
Yeah.
so people who are obese, what are the exercise recommendations and precautions, especially kung magsisimula? Because someone who is obese is probably also sedentary. So, ano yung maipapayo natin?
For obese individuals, I'm talking to the fitness professionals and the physicians now. Um, we also have to put in front yung psychological component. The American Academy of Family Physicians advises na yung discussion on obesity does not happen on the first consult. Build rapport muna. A lot of obese patients will not want to discuss about it. Body image issues, mga ganun. Pero syempre, madidetect mo naman na yung obesity. You get their weight, you get their height. If you're more of, may capacity ka pa to do further test, waist circumference, hip circumference, mga ganun bagay lang. Tapos, talk about the primary problem muna. Kung ano man yung kinonsulta nila for you. Kung gusto lang nilang mag-engage in training din, talk about what they like about exercise, bakit sila pumunta ng gym. You find out how they are interested or how they get themselves interested into doing exercise first. And then on the second visit or second interaction, that's a good time to talk. A good approach would be, last time we got your weight, we got your height, and I checked on your BMI and I noted na ganito siya at this level. Are you okay if we talk about obesity or yung sa pagpangangatawan po? Okay lang po ba kayo? Open ba kayo to discuss that? And then dun na, that's where you trail off. Kung hindi maganda ang rapport nyo kasi and you talk about that kagad, back away na yan. Body image issues eh. So now that you have good rapport and open na yung kliyente to talk about losing weight for their own health, that's when you get to the specific. So for obese, actually, walang specific na, again, general recommendations pa din yan. The primary goal here really is to get to the frequency first and make sure na interested sila enough and yung mga roadblocks, sakit sa katawan, demotivation, na hindi ko gusto sa ganitong environment, lahat yun ma-address nyo muna sa simula. And then, start low and slow. So, as we've mentioned time and again, most probably sedentary yan. So, low intensity muna. 40 to 50% of the heart rate reserve is the recommendation for aerobic programming. And then, as much as possible, we want all muscles moving per session. Kasi, di ba, exercise physiology, sa conditioning, the more muscles are working at a given time, mas malaki yung caloric expenditure. And then we also have the epoch, yung so yun, wala namang specific time for obese individuals. Ang gusto nating i-maximize is for the time na kaya nung tao, you design programs and you choose exercises that majority of the muscles are moving. So, scenario, common scenario. Oh, merong kliyente, malaki yun mukhang obese Sige, train natin siya. Anong bibigay mo exercise? Bicep curl, tricep extension, leg extension, dito sa machine. Nothing wrong with those exercises. Pero kung pinaupo mo yan sa machine, binawasan mo na yung effort na gagawin niya for the day. Pwede rin naman, applicable siya. Pero again, less muscles are working for the time that you're putting the person on exercise. Hindi mo na maximize yung oras. There are low-intensity activities. May mga isometric na standing exercises that you can do. Modified push-ups using 2-foot bench para lang ma-orient sila ba. They have that feeling pero hindi sila sobrang pagod na hindi na sila babalik bukas. Tapos yon, in terms of weight, so syempre, regardless kung bata yan o matanda yan, joint loading is an issue. So, as much as possible, wala tayong high impact loading na movements, mga jump squats, walang ganyan.
So, walang plyometric sa first day ng obese na mag-enroll sa gym?
Kung ayaw mo siyang bumalik bukas, sige, plyometric.
Mga depth jumps, mga ganun.
Walang baka iba yung bumaba ang depth. Delikado kasi, yan top heavy, tapos yung muscle development tsaka coordination ng lower, yung posterior chain na tinatawag natin, wala pa dyan. So, you can have an accidental fall at Where at minimum, you can injure yung plantar fascia, yung sa paa, yung talampakan. So, plantar fasciitis can develop. Or injure the knee. So, yung mga, tawag ito, runner's knee or yung suprapatellar tendon na inflammation. Since sedentary sila, the first time they encounter exercise, ang first memory nila is pain.
Hmm.
Diba? Madali ng pag-isipan yan kung saan susunod yan. So, ayun.
But
Sige po.
but the obesity itself, it's not a disease, 'di ba? But it is a risk factor. So, tama ba? I mean, so in other words, just because someone is obese, can we consider it na that's a disease or it's simply a risk factor?
Um, Parang wala pa naman ako nakitang definition ng obesity as a disease.
'Di
But
ba?
true, it's a
But
risk factor for a lot of things. So when we encounter obese patients, we have to think on a broad perspective ba? Hindi lang yan physical na sakit. Pwedeng meron, most of the time they will have body image issues which you have to
Mhm.
consider at the forefront. Uh, so yun, yeah, this factor more than a disease itself on its own.
Yeah. Talking about obesity, is the recommendation still the same by PASOO na 10% of total body weight in 6 months? Is that still the recommendation? That's the
In terms of weight loss,
yes.
I think wala pa namang update sa ano. Ang safe weight loss, yeah, you can base it with that, 10% of the total body weight for 6 months. Um, Kaya lang pag obese kasi, ang computation ng target weight mo will be different from someone who is not obese. So, overweight,
Mm.
normal, hindi natin ita 10% kagad yan. There's such a thing as adjusted body weight.
Mm.
For obese patients, 1 to 3, doon natin i-base yung percentage na yan. As a rule of thumb, pwede rin naman kayong mag-settle for 5 to 10% of the current weight. No? Sorry, 5 to, sorry, tama ba? 1 to 2 kilos per month na weight loss. So parang hindi na siya percentage, talagang ano lang siya.
Fixed number.
Ayun
Absolutely.
yung mag-compute.
So, I guess it's safe to say,
Yeah.
wisdom, na mali yung ginagawa ng The Biggest Loser, no?
Well, actually, 'di ba lumalabas
Ano
nga
bang,
dun sa Biggest Losers, majority of the participants actually regain back
Yun nga.
the weight loss.
yeah,
Yeah.
And of
So
course,
they did. I saw
yeah.
that study din eh.
Yeah, 'di
60%
ba?
ata ng mga, after 10-year follow-up,
Oo. Hindi
they
siya
gained
sustainable, eh.
back and increased pa.
Kasi nasabi nga ni Doc kanina yung, it has to be a holistic approach, lifestyle, body image issues, no, nutrition. But maganda rin yung point yung ano, yung managing the weight for obesity is relative na hindi iba yung target weights na percentages for the obese, overweight, and normal. Kasi for example, kung galing ka sa BMI na 38, which is I think obese 2,
Mhm.
and then you bring it down to 31, yung BMI mo. Obese ka pa din. But
Mhm.
that's a big difference, di ba? That's a big difference in
That's true.
not only the itsura ng tao, but also with their possible health outcomes, no? If they were able to bring it down through proper nutrition and exercise, no? Someone who went from 38 BMI to
Mhm.
BMI 31 is going to be much healthier even though obese siya. Now, ito yung tanong ko. Kasi pwede naman silang magbaba ng body weight lang through nutrition, eh. Mag-diet lang sila. 'Di na sila iinom. 'Di na kami kakain ng rice. What's the value of bringing your weight down to from obese to kahit overweight or even back down to normal with just diet, which is very much possible, and bringing your weight down to a healthier level through diet and exercise? Anong added benefit?
Nung nagtrabaho ako sa Gold's Gym, I learned one adage. You don't make abs in the gym, you make abs in the kitchen.
Mhm.
So in terms of obesity and diabetes as well, diet actually ang maunang i-adjust. Although syempre, ano rin, may tulong. Actually, exercise, 300 to 400 calories per yung typical na 1 hour moderate session natin, achievable yon. Pero ang tanong, daily ba kaya bang gawin yon? But when it comes to diet, caloric restriction pa din ang general rule. I think you've had discussions about this before. Yung mga iba-ibang fad diets na yan, may kanya-kanyang label lang sila, but the bottom line really
Yep.
is caloric restriction. Wala namang, you can consult with a nutritionist to give you parang exact numbers based on the weight. May Harris-Benedict equation tayo na ginagamit, di ba? Pero again, relative pa din yun. It's really, yung caloric estimation na yan is just an estimate. Kung susundan mo yon, yung hanggang ngayon, the rule pa rin actually kahit sa amin ang sinusunod is 500 calories na deficit per day. Then yung 3,500
pound.
calories for 1 pound of fat. No? Hanggang ngayon, yun pa din. No? The science hasn't really touched advances on that. So yun, we can do that as part of the discussion. Pero let's not forget, no? Alam ba nung pasyente or kliyente paano magbilang? Saan niya hahanapin kung paano siya magbibilang? Pag pumili ba siya ng pagkain at nasabi mong bawal, ano ipapalit niya? So you have to have those discussions. What I do with my patients personally, so yun, na-discuss na yung obesity on the second consult. I teach them calorie or food label identification and reading. Kasi in practice, I've actually seen a lot of patients don't know how to read nutrition facts lang. Yung sa likod, di ba? I mean, everybody goes to the grocery, lahat pumupunta ng palengke, and I don't think anyone has not encountered yung ganon, yung label na yun. Pero syempre, wala naman nagtuturo paano magbasa nun. So to achieve that, yung calorie deficit na yon, we have to teach our patients hindi lang yung meal plan. Kasi yung meal plan, madaling mabulilyaso yan eh. Paano kung wala akong pambili niyan? Paano kung hindi yan yung nakahanda sa bahay? Paano kung ayoko niyan, di ba? The nutritionists will discuss that. Pero you have to discuss how to make food alternatives or parang food choice alternatives. And that's by reading the label talaga. Nakalagay naman dun eh. How much calories per package, per serving, ilang servings ba nga sa package. And then you have the amount of sugar per gram. And then what one good tip to make them more visually or ma-visualize nila kung ano ba yung pinapasok nila sa katawan nila. What I teach my patients is 4 grams of sugar, isang kutsarita yan. Isang kutsarita ng asukal yan. And then, if I have 1 teaspoon of sugar, kakainin mo? I give you 1 teaspoon of sugar, will you eat it? And sabi nila, okay, sige, 1 teaspoon's fine. And then we go to 3 teaspoons and then they say, that's too much. And then I show them the packet of their Nescafe Creamy White and then we see that it's 12, I think, or 15 grams of sugar. So divided by 4, that's about 4.5 grams. Ay, 4.5 teaspoons.
Yung ano nga lang, yung mga regular soda nga lang, di ba? Isang can.
A can of Coke is 28 to 33, if I'm not mistaken. 33 yata na grams of sugar. For 1 can.
Teaspoons, yeah.
Divide mo by 4. Nasa 8, mga ganun.
Yeah. Ang nakikita mong trend dito is with when you're managing your health conditions, exercise will benefit you regardless. And then alongside that one is managing your condition with the proper medication if applicable, and also being in touch with your service provider, kung nutritionist man yan, if you are obese, cardiologist if you have a cardiovascular illness, no? But either way, it's exercise alongside with proper guidance and management of your condition. Parang ganun eh. So hindi siya never na pahinga ka na kasi may sakit ka na.
Exactly.
Yeah.
For a lot of conditions actually. Hindi lang cardiovascular.
Let's switch gears. Let's talk about something that involves or affects the female population more, or specifically, sila naman kasi may ovaries, diba? So let's talk about PCOS.
Sige. Yeah.
Let's talk about PCOS, which is first of all, define PCOS, and are there any specific exercise prescriptions for somebody with PCOS, or general recommendations pa rin ba?
For PCOS, bali ano siya, syndrome siya. So there are multiple manifestations. And actually, sa criteria for diagnosing PCOS, hindi yung polycystic ovary yung primary. It's amenorrhea or parang irregular or lack of menstruation. Tapos, hyperandrogenism or sa babae, parang merong male features. So that's parang curled yung hair or body hair in places na hindi common sa babae. Or mas malaki yung body fat. So insulin resistance is also part of the disease process. And then you have the polycystic ovaries. Some women will be diagnosed with PCOS na hindi ovary talaga yung may issue. It's more of a hormonal disturbance talaga. With recommendations for PCOS alone, hindi rin naman nagbabago. You can give the same recommendations as the general public. Ang goal, especially if yung mga OB na nakakausap ko and some of their patients that I've talked to, i-recommend mag-exercise sila. Pero ang nangyayari, the conversation stops there. How much? How do I exercise? Where do I exercise? How can I learn how to exercise if I haven't yet? So, general recommendations for the adult population will follow. But yun, if some, hindi lahat pero some PCOS patients are not really obese or overweight. So, kung overweight, then yung pinag-usapan natin, you can focus on that. Start with the proper establishment of rapport, open the conversation on body image issues kung meron ba. Pag PCOS, so syempre may male hair patterns or parang iba yung pakiramdam nila sa katawan. Pwedeng may acanthosis din sila. If merong, yun yung parang hindi yung libag pero maitim yung sa leeg, which is a manifestation of insulin resistance. So lahat yun, psychological yun. No? You have to discuss or the care provider should be able to discuss that and then recommend exercise. With regards to the fitness professional, just be mindful lang pagkakausap. Siyempre, proper rapport. Yung mga iset aside lahat ng mga kung may comments ka about the person's body. Dapat naman for all naman to. Hindi naman to sa PCOS lang. And then yun, proper motivation, find out ano bang interest nila, what stops them from exercising, and then negotiate na lang one day at a time for them.
Yeah.
Wow. Actually, I think this has been our longest episode na so far.
Yeah, pero
Bakit
di ko,
naman-
di ko
ang
feel eh.
dami kong natututunan and
Oo.
actually it has erased some of the doubts or some questions no na okay ganito pala. And also in a way it has simplified yung how do you manage the considerations for people with special health concerns. I think we'll have to have a different episode din later on kasi ang dami ko pang itatanong sana about gout, scoliosis,
Yan.
rheumatoid
Ayan.
arthritis, musculoskeletal. Pero siguro abot na tayo mga alas 10. But I think maraming maraming matutulungan both professionals and practitioners and even doctors kasi marami pa ring doctor actually na conservative conservative yung pag-manage ng patient. So, yeah, thank you very much. Hindi ko napansin na parang almost magto 2 hours na tayo.
Actually, before we
Yeah.
end, I wanted to ask. It seems like most of the conditions we discussed, exercise is still parang it's common eh. Doc, can you think of any condition where exercise is parang talaga of course aside from the obvious na parang may pilay ganun pero can you think of any lifestyle related condition na where exercise should be not permitted?
May listahan ng ACSM actually for all the conditions na contraindicated or talagang bawal ang usual exercise programs. And if you want, I can show you the list. I think I have it here. There. Okay. So, para lang din ma-take note na rin siguro ng mga nakikinig sa atin. Sige, let me share. Okay. Can you see it?
Yes.
So,
Yep.
yeah, this is from the American College of Sports Medicine's manual on exercise prescription and testing. So if you will see here, dalawang category. So yung bawal mag-aerobic and bawal mag-resistance and aerobic sama, sorry. So yan, makikita nyo dito, most of these are diseases that you might not even encounter sa regular na gym setting. However, I would like to point out a few na siguro sa inyo, Sir Chappie, 'di ba, sa athletics sa CHK, no? We're handling adolescents na walang sintomas pero might need screening and risk evaluation prior to joining the training program.
Hmm.
I will identify a few. So yung Marfan syndrome, connective tissue problem to na pwedeng mag-cause ng mitral valve prolapse, yung parang yung valve sa puso mahina. Madali siyang ma-screen kasi yun yung mga matatangkad na teenagers na hyper-flexible joints.
Yeah.
Na coaches might probably think na, oh, very flexible yung natin. Okay to. Beneficial to for whatever sport that they're doing, gymnastics, taekwondo, or what. Irregular heartbeats. So, makikita to usually sa ECG. Yung mga bata na mayroong congenital heart defect should definitely be screened prior to joining. Kahit na nasara naman before or naoperahan naman na po, okay naman na daw ako, screening pa din prior to joining. Kasi kung merong irregular heartbeat or baka may beginning na early onset heart failure pala kahit na address before, mahuli bago magkaroon ng problema. Tapos yun. If you will look at this list, most of this is really cardiovascular talaga. Screening can start, actually family medicine does screening prior to pre-sports participation. Pero you can also consult with cardiologists, lalo na kung complicated yung mga sakit. In terms of musculoskeletal limitations, so depende siguro, na-mention ni Sir Wisdom kanina yung scoliosis. So depende sa degree of yung kung paano siya nakabend. May natawag na Cobb angle. May mga recommendations ang orthopedics na mag-rehab med muna before this patient can engage in whatever kind of sport they want to do. Na-mention nyo din, I think, yung rheumatoid arthritis. So, magkaiba yun yung rheumatoid tsaka or osteoarthritis. For rheumatoid arthritis, is an autoimmune disease kasi. So, dapat makita mo na ng doctors, ma-screen yung mga complications ng rheumatoid arthritis. Yung pain control should be there muna bago sila mag-engage in training kasi mabilis maga yung joints nila. And may mga flare yan eh. So, dapat walang flare bago mag-exercise. So, yun, relative na yun. Kung walang flare, control ng pain, go ahead. Regular exercise. Pero definitely, because it's an arthritis, you might want to not put plyometrics there. Walang mga shuttle run yan. Walang mga depth jump yan. Walang ladder drills yan. Muscle strengthening will be at the forefront kasi yung support ng joints mo will help with the pain reduction. So, ayan. Take a picture. You can also look at the book. Andun yan. No?
Galing.
So, yeah.
So, galing. Again, Wisdom, I feel like, I didn't feel the 2 hours passed by, actually.
Yeah.
We're gonna have to have Doc back for another discussion. Ang dami ko pa gusto tanongin like cancer, other mga
meron din.
I think
pregnancy
ang
actually
mangyari
is also
yun, gusto ko rin tanong yan eh. So, yan, pregnancy, after giving birth, how long after giving birth, kung C-section,
even while pregnant.
Yeah.
Ayan, so next episode,
Next
a different episode, but
no
I think at least people can ask questions na kung magko-comment sila. So if we do another recording, pwede natin ihabol.
So Doc, again, thank you very much. How can the people, our listeners, if they want a consult with you, I know you're not very much in social media, pero if you are, I mean, where do you hold your clinics and how can they have a consult with you?
Currently kasi kaka-start ko lang. So I work with Makati Life. Kami ata ang first na merong 24/7 na outpatient. So hindi po to emergency room Yung sipong ngayon lang masakit ulo ko, magpapakonsulta ko. We accept all patients na non-emergent. So I have a schedule there with the rest of the doctors. I'm usually there Wednesdays ng hapon tsaka Friday early morning. Pero you can also have consult with the rest of my colleagues. In terms of siguro kung specific, if say fitness professional, merong gantong kliyente na may medical condition, I have a now serving account. So yun yung parang ano namin, yung teleconsultation
Yes.
platform. My contact is there and they can just advise, may QR code yun for registration.
Okay. So now serving app, you can find. I guess if they search your name, lalabas,
Yeah.
lalabas rin. So search for
Lalabas na.
Dr. Fidel Ballesteros in now serving. Wisdom. Kamusta? I mean, dami natutunan.
Yun lang. Thank you very much. Dami ko natutunan. Actually, dami ko pang itatanong, but on a different episode. If you have questions, then we might just be able to ask that on the next recording. But, Doc, thank you very much. I know doctors can be very busy, especially since si Doc Fidel also has other things na ginagawa. Ano? So, thank you very much for the time. For sure, maraming matutulungan ito. So, we really appreciate it.
Thank you din po for the invite. This is a good discussion.
Thank you very much, Doc. We learned a lot. Again, this is Coach Chappie with Sir Wisdom and Doc Fidel for episode 7 of the Fitness Faculty Podcast. If you haven't, please like and subscribe. Follow our YouTube. Subscribe to our Spotify at the Fitness Faculty PH or Fitness Faculty Pod. And we'll see you guys for our next episode next time. Bye-bye.